Hello, I'm Robert. I'm a science blogger, I'm a software developer, and then I'm a science blogger in my spare time, and for the moment I'm mainly doing fact-checking. And I do this to help very scared people. And it's as a result of the recent infodemic, which I would say going back to the climate change scare stories as well. And I help run Doomsday Debunked, which is a group on Facebook of other fact checkers, and we help very scared people with checking the stories. Many of the people who come to the group are also getting help from psychologists and psychotherapists, and we, of course, try and help people to find a therapist if they need that sort of help. We also have members who are very good at reassuring and helping people on that level, but we are not psychologists. We are fact checkers and not psychologists. So anyway, this is me fact checking the some of our members have expertise in that area, but I'm saying that's the focus of the group, is fact checking. So I'm talking about this is about these stories that are scaring people, that a lot of these dramatic spikes that we're getting in the United States. I think they're going to be spikes and they're going to come down again eventually. So if you look at Arizona, and that's increased from 300 to 1,500 cases per day in about 3 weeks. But what these stories miss out, about 20 like that, what these stories miss out, that there are 12 where they're mostly the same, and these top two, New York and New Jersey, I don't know why they're there, because they're going down, and they've been going down for weeks. And then there are another 19, plus those two make it 21, where it's actually decreasing. This increase includes overseas territories, which is why the total is more than 50. So it's not looking as bad as it seems. And if you look at it, for instance, Arizona has this big increase, going like that, from 300 to 1,500, but look at, say, Virginia, that's got a big decrease. And if you look at the top 10, then New York and New Jersey have been decreasing for a long time. Blue is decreasing, yellow is the same. California is increasing slightly, rising. Texas is rising, and Florida is rising. And then the other ones are decreasing, for a total of 7 of the top 10, and 500,000 for New York and New Jersey together of peak cases, and that's decreasing. If you look at the cases per day, then that's sort of steady, but it's been decreasing, then it went steady. And if you look at the deaths, that's going down, that's a little bit of a lag, and that's been going down for a long time. So what is going on here? Well, some people try and paint it as being, oh, it's all the Republicans, because it tends, for a certain extent, it's been Republican states that have been increasing, but I don't think this is a Republican versus Democrat. Look at California, that's the third down, and that isn't increasing. I think it's much simpler. It's I think it's the states which have most cases per population. The ones, basically, if you start exceeding your ICU capacity, then states start to take it very seriously. And that's happened to New York and New Jersey. Or if you get a rather dramatic increase, California doesn't seem to have been hit bad enough yet for them to take it so seriously. And Texas has been hit pretty bad, and Florida. Texas is an interesting one because they are taking it quite seriously, and they got rather hit by a scandal because Texas, they paid over 100 million to a firm to do contact tracing, and it doesn't seem to be doing its job properly, not very thoroughly, and it's turned to a bit of a scandal. The CEO of that firm lied. He told them that he had a doctorate, and he didn't. Now, of course, the CEO of a contact tracing firm doesn't have to have a doctorate, but it's a bit of a red flag that the CEO would say that he's got a doctorate when he hasn't. And so there's a lot of discussion going on. So anyway, I won't go any more about that. But so this seems to be the situation, though. And if you go and look, for instance, I mentioned Virginia. Am I on Virginia today? No, this is the New York. I'll look at New York first. So New York this is a site called COVID Act Now, and it's a great place to go and look and understand what's going on under the hood. So if you look at the three things really to look at, ICU, well, 4 things, all of those are important. Infection rate is below 1, that means it's decreasing. Positive test rate is very low, that means that they're testing lots of people, because if that test rate is high, like about 10%, the WHO say if that test rate is above 10%, it's not a sure thing, but it tends to mean that you're not testing enough people, because you're only testing the worst, the most obvious cases. You're only looking where it's most obvious, where there are lots of people, big outbreaks. Yeah, but they're looking just about everywhere. They've got lots of spare capacity with the intensive care units, and they're testing all the contacts. They're tracing all the contacts. At least they've got the capacity to trace all the contacts. Now that's only quite recently that they got that capacity. We could just right at the beginning of June, big increase. It was the Bloomberg Foundation that gave a big injection of money to pay for the contact tracing. It's quite expensive, so they've got now they have 9,600 contact tracers. That's going to be quite a lot of as full-time jobs. That's going to be quite expensive to pay all those people every month. But it's nothing compared with the cost to your economy of a lockdown. And this is what countries are learning gradually. So New York didn't discover that really, didn't understand the importance until the beginning of June. That's quite a long way into its outbreak. If you go and look at the New York outbreak, and there they are, the peak was in April, went all the way through May, and all the way through to June, and that's when they realised how important it is to have enough contact tracers. The WHO was telling us all, way back then, in April, in March, they were saying way back in March that we should increase contact tracing, and they said the lockdown was an ideal time to do it because you have much less contacts during a lockdown. But New York didn't pay any attention to that. So when you get these people saying, oh, New York had a Democrat governor, so they did it right. They didn't really. They didn't do enough contact tracing until June. The cases went on for 2 months with totally inadequate contact tracing. They could have gone down much faster if they'd had enough contact tracers. And it's not through lack, they just weren't listening. The WHO was saying over and over again, this is the ideal time, do the contact tracing, it'd be much easier. Most people only have maybe less than 10 cases, maybe even 5 or 6, half a dozen for some of them. And now they've got 20 or 30, and it's much harder to do the contact tracing. But New York didn't listen, not until June. So this is, it seems for some reason, maybe it's partly because of the idea of freedom of speech and thinking that it's not really violating anyone's rights. You just ring someone up, and New York has the best contact. The Johns Hopkins University gave an excellent course. I actually did the online course in contact tracing. It's really, really good. I haven't done all of it because I wasn't trying to get a qualification. I just went to the bits that I was most interested in, perhaps half of it. And I strongly recommend, if you want to learn about contact tracing, do the Johns Hopkins online course. So now they're doing it really excellently. They're doing a very good job of the contact tracing. They're doing it as they ease lockdown. So that's how they're doing it in the States. They're doing the contact tracing after they ease lockdown. Now if I go and look at Virginia, yes, I'm looking at Virginia here. And Virginia, yes, that's it. So they have, so there are only 2 states. If I look at all the states, the ones in green have adequate contact tracing. There are only 2. New York, 3. New Jersey, New York, and Michigan have enough 100% contact tracing. And well, they've got 100% contact tracing, and the other things are good as well. Virginia is doing pretty well. It's got 50% contact tracing, and they've only had that recently though. See, they started June 12th. It's only about June the 11th that they start having anything like enough. Back then it was just barely adequate. 22%. That's not enough. And so it's no wonder that Virginia has started seeing a decrease. I've gone up and look there. You can see that Virginia's got a little decrease recently. It's increasing its contact tracing, but we'll see the full account of that decrease later on in June. Now it's got plenty of them. It's only got 50%. It needs another 1,000 or so, and it'll be fine. If it's going down and it's got more contact tracing, it'll be doing well. And but now if you go and look at Arizona, so I haven't looked at Arizona yet. Look at Arizona, and it's doing really badly. It's got a 17% positive test rate. That means that it's not testing enough people. And in addition to that, then people in Arizona say that they sometimes don't get the test result for a week. People in Africa, quite early on in the outbreak, they managed to turn around for a couple of days, or a day or so. But in Arizona, then some of the results are not coming back for a week. And the contact tracing, they've only got 1 in 100 they've only got 100 of the contact tracers they need. Look there. 100 for needing 1,740 daily cases. Imagine if you were one of those poor 100 contact tracers, and you've got basically 10 to 20, getting on for 20 cases each, and you've got to try and trace 10 to 20 contacts of each of those cases. They need 8,700. You need several contact tracers to each case because it's so labour intensive. Basically you need several, for each case that you have, each new case a day, not each existing case, you need several contact tracers. There's an awful lot of work involved. If you try the online course, you'll find out. You've got to talk to the original person, and they're going to be quite scared and you're going to have to talk to them in a compassionate way, passive listening. They're going to be quite confused. They may not really hear what you're saying to start with. You've got to kind of, if you do your job properly, and some contact tracers probably aren't doing it properly, then you've got to see them through this, make sure they understand what you're talking about. You've got to listen to their concerns, then gradually try and jog their memory of what they did over the last few days, which you can only really start doing once you've started building a rapport with them and get over the original fear. When they're just panicking, I've got contact tracing, I've got COVID-19, well, what's going to happen to me? Then they're immediately going to start think, what's going to happen to all my friends? but they need a calmer space to start thinking about who they saw that, like, did I speak to my neighbour yesterday morning, kind of thing. Contact tracing takes a while, needs to be done patiently and carefully. And then you have to go and contact the contacts they've identified. It's not a privacy concern, because if the original contact doesn't want their friends to know that they've got COVID-19, then you don't tell them. You just tell them they're a contact. And then the original person who is also isolating, they don't have to tell their friends if they don't want to. But, many will, but if they don't want to, they don't have to. If it's some colleague at work or something and they're embarrassed about it, then the colleague will just get a telephone call saying that someone you've been in close contact with has had COVID-19. And so so now this makes a huge difference to COVID-19, because the cases, because you are infectious for a long period, anyway, I'll go into that in another video. I won't go into that now. And then some people say that masks will do it, but it's not really it's pretty clear. There's some low quality papers that suggest that masks are as good as contact tracing. It's not true. Contact tracing works. It just so happens that countries in Asia where people wear masks anyway have turned out to be good at doing the contact tracing. One way to think about it is to remember that many of these people had masks before their outbreak started, and the masks didn't stop them getting it. It was the contact tracing that was what really put an end to it. And masks just help in addition, and only if you are very close to people, because it is not airborne, it's not like flu. It's the bigger droplets of coughs and sneezes and so on. Anyway, so that's the problem, and that's what's going on. Is that places like Arizona are not doing enough contact tracing. Now, so you get some people saying that there is a difference between the Republicans and the Democrats. That is not true. Remember that New York is Democrat, and they were very, very late in doing the contact tracing. They did the lockdown, but they in Arizona, then, for instance, for the Republican Greg Stanton, he's a Republican and he's very critical of his governor. And he's saying very strongly that we've got to put politics aside and ask what can we do to protect our fellow Arizonians. And amongst his things he says we have to do is contact tracing. So don't feel that you're betraying the Republican Party if you vote Republican and you think contact tracing is the way to go. There are plenty of Republicans that agree with you on that. And then there are plenty of Democrats that are just like California, they're just not taking it seriously enough, not doing social distancing enough, being just too lax about everything. And so it's not really, I think it's best not to make this party political. What it seems to be is that the states with lots of cases, eventually, once they start hitting the running out of intensive care units, and once they start getting like it's been in the United States, you get also people in care homes dying and things like that. Once you get feedback like that, once you're well into your outbreak, the deaths don't happen until about 3 weeks into the outbreak. So if you have a big surge in cases, for instance, Arizona has increased from 300 to 1,500 cases in 3 weeks. It will start having a big surge in deaths in about the next week or two. And you go and look at the United Kingdom, we've had that, and people start taking it really seriously once you start getting that big surge in deaths. And once you start getting the intensive care units reaching capacity, then people start taking it seriously. Then they start saying, what are we doing wrong? And they start to think about contact tracing amongst everything else. contact tracing, isolation, testing, surveillance. The WHO have said that over and over again, but each country seems to need to learn it on its own, one after a time. The United States, then I was hoping myself that the states that the states would learn from each other. They are to some extent, but not enough. So that is what's going on. So that is why you see, Republican 5 steps to a safer Arizona. So I expect that these will turn around. We see that happening. Look, there we've got Kentucky going up and going down. We see these are all fairly steady. These can start going down as they increase the contact tracing. The contact tracing can be employed people, can be volunteers. And so if you are in the United States, try and put pressure onto contact tracing. The other thing that is very important is that the people, that you yourselves do the distancing, physical distancing. Do use masks if you can't do the physical distancing, or if your state requires it, because you don't want to scare other people. But the most important thing is to keep a distance of at least a metre. A lot of people say 2 metres, the WHO say 1 metre. Now, I go by the WHO. In all this, all the way through, they have always turned out to be telling me the correct advice. And then, as new things are discovered, it's always the direction the WHO was saying that turns out to be the ones who got it right. And the people who do the modelling and so on, they're generally the ones who get it wrong. And the WHO, they've given excellent advice all the way through. If you follow them as I do, if you don't listen to their opponents who misrepresent what they said, if you listen to what they say, then they give excellent advice. And they have tested, checked very carefully. There's no evidence of airborne transmission. So, if you look at SARS, then you don't get it just by breathing. If you look at SARS, then very early on, there was the Air China 112, I think it was a flight where one person got onto this plane. When they got off the plane, there were 20 people infected, a super spreader event. This didn't happen at all with any of the flights back from Wuhan. One person with COVID-19 gets on the plane, one person with COVID-19 gets off the plane. I think you could hardly have more striking evidence than that it is not airborne. Researchers in the very early cases, like looking for instance at an early case from Canada that came back on a plane from China, didn't know that they were a COVID-19 suspect. They did the analysis like they did for SARS, and with great surprise found that she hadn't infected anyone. So the WHO, they have access also to empirical data from their partners, including researchers share their research mid-research, even before they have a preprint. They talk face-to-face to experts around the world in big Zoom gatherings, conferences every day. They're off doing Zoom conferences with experts around the world. The WHO have access, and they do rapid systematic review. Systematic review means you take account of all the data, including unpublished data. The WHO have huge access to unpublished data. Nobody else is in the same situation as the WHO when it comes to the ability to do systematic reviews. The reason is WHO has gained the trust of countries worldwide, and they just tell them things they would never tell anyone else. This also is why it was totally impossible for the WHO to do what Trump asked Tedros to do. Trump asked Tedros to criticize China and shame them publicly. If he had done that, he would have lost his access to being able to talk privately to China, because he would be using whatever private information they shared with him to shame them publicly. He would also have to shame the United States publicly, if he starts doing that. Because the United States, they didn't do enough testing until March the 3rd. They only done, by March the 3rd, they'd done only 20 tests per state. Average, way, way too low. If Tedros is supposed to shame China for various things they've done wrong, then he's supposed to shame United States for not doing enough testing. He's supposed to shame United Kingdom for dropping tracing and testing. He's supposed to shame Brazil for not taking it seriously at all. He would not be able to keep his job for an hour if he started doing that. So this is why what Dr. Tedros, what the Trump says about Dr. Tedros is totally impossible for Dr. Tedros to do. It is not possible for any Director General to do that. So WHO are in this situation where they have the trust of everyone, including North Korea. You have a WHO office in North Korea. You have a WHO have close contacts with Iran, with China, Russia, anywhere, then WHO are there. WHO are involved in helping North Korea to get rid of other infectious diseases. I think measles. North Korea, you may not know, is actually very good at distributing vaccines. And it can vaccinate its entire country. When we get to a vaccine for COVID-19, North Korea will be one of the best in terms of coverage. So it has a huge advantage in some ways. You can well understand being an authoritarian kind of regimes, really, but they're very good at that. Anyway, so the WHO have very close contact. They're able to talk to any country privately, and they say whatever they say private stays private, so people can trust them. And they are in a perfect situation to do systematic, rapid review, and nobody else, no individual country, the United States can't do that. The United States doesn't have access to private information from China or private information from North Korea or private information from Iran or Brazil. So the WHO is in a unique situation, and they assess that it's not being spread airborne. They've assessed all the public, they do rapid scientific systematic review of all the published literature, the unpublished literature, the things that people tell them privately in their Zoom discussions, and they can ask them questions, what's going on in your country, where are the super spreader events going on, and so on. And they may tell them things that they don't want to tell, say, publicly for some reason. They could say, there's been a super spreader event amongst the government officials, say, and maybe they don't want to, they're embarrassed to admit it. So WHO has unparalleled access to things that other people can't access. And so I go by them, and they say that it's not airborne, and that the 1 meter rule is sufficient. They say 1 or 2 meters, but 1 meter is if you stay 1 meter away, if you are careful, and you only need to worry about when you're talking to someone. If you're just breathing, you can be closer, it won't matter. If you're side by side and you're both talking forwards, if you turn and talk to someone, then that's when you risk infecting them. But if you're both talking side by side as you walk, then the droplets you produce, they go down to the ground in seconds. And that is why it's very important to do the distancing, to wash your hands thoroughly, and so I'll bring up the protection thing at the end. So we have to do this together. We have the governors and the states, they have to do the contact tracing. We can't do the contact tracing because of privacy concerns. You can't go around asking people, did you get COVID-19? Tell me who your contacts are, and I'll go and try and find them for you. Some doctors have tried doing that, but they get very little uptake. I mean, doctors do have a certain amount of privacy connection with their patients. The patients are still reluctant to tell them things. You know, they get much less uptake when an actual governor or a state starts a program and then they set it all up properly. So anyway, so that's what you I think the situation is quite optimistic, because people are gradually realising, and the example of New Zealand is very striking. We have had these huge increases in contact traces, but Arizona needs to do a little zip up in contact tracing. It needs to employ a couple of thousand contact tracers, and then that'll make a huge difference. It needs to do something like Virginia has done. Virginia needs to do something like New York has done. Arizona needs to do what Virginia did. See, up to the June the 1st, then Virginia was no better than Arizona. Then it went right up into this huge surge in contact tracers. And it also must have had a big surge in positive tests. See, the positive test rate is going down. There's testing plenty of people. And so if you're in Virginia, that's a good state to be. That your cases per day are going down and you're doing everything right. And then it's just a case of patience, being careful yourself. Your state is doing the right things. Do the right things yourself. Keep the distancing, washing, protecting yourself, and then things will get sorted out. And so I think the situation is much more positive in the States, but we need some patience. We need to realise that it takes a while for states to come over. It must be terribly frustrating if you're living in a place like Arizona. And like it was very frustrating for me in the United Kingdom for a couple of months, and my country just not doing things right. It's gradually starting to do things right now. So some of you are in the same situation I was in the United Kingdom for the last couple of months. And it just depends how long it takes for your state to come over. But if you are very careful, you won't get COVID-19 yourself. Unless you are a healthcare worker if you are in a risky situation, make sure you do all the extra protection you need to do. If you're just isolating at home, then you can do a lot. And even if you're working, then you can do a lot by just not touching your eyes, nose and mouth. You may have noticed I haven't touched my eyes, nose and mouth while talking at all. I would normally be up there all the time. I can do it quite safely because I haven't been anywhere near. I can actually touch my eyes, but you shouldn't do that. My nose and mouth, I've done all the wrong things there. But I could do that because I know that I'm in a house that hasn't got COVID-19, and because I haven't been anywhere, I'm not a contact. I haven't been anywhere near anyone with COVID-19. Keep a distance, but you should not. But it's best, as I'm doing, to just get out of the habit of touching your face. Then, if you do that when you're at home, then you'll be doing that all the time automatically. It's called intention something or others. It's behavioural intentions or something. I was told by someone who knows about these things. What is it? Anyway, you get into this. You can develop these habits that are triggered by the situation you're in. So try and develop habits that are triggered by the situation you're in. If you're outside your house, don't touch your face if you can get out of the habit, if you possibly can. If you can't avoid it, be sure to wash your hands first before you touch your face. If you've touched anything in between, which could possibly be a contaminated surface, or say you shake hands with someone and you don't know if they've washed their hands, then wash your hands before you touch your face. But again, it's really quite difficult to get COVID-19. So yes, I think sorry, I'm being a bit repetitive. I've said this before. I'll give the link to the to the to my thing about how to protect yourself.